All right, so welcome back to the show. This stays the AM Club right here on MX24. Now, time for us to get into the Lifestyle Daily conversation for today. Yes, today we're talking sickle cell disease, all around it, and we'll get into that pretty shortly. But before that, at Equity Health Insurance, the well-being of our members takes precedence. We recognize the unique health care needs of individuals and families, which is why we are delighted to present our Ebusua Health Plan. This health plan is crafted to promote the enduring health and happiness of you and your loved ones. Our plans are meticulously tailored to offer comprehensive and competitive health insurance coverage for individuals, families, and smaller groups. Access to quality care is just a phone call away. So offering continual assurance of your family's welfare, please kindly contact us on 05446 645 or 465 or 0503 860-381, hashtag here for you.
Also, the Ghana Garden and Flower Show 2024, they're saying get ready to innovate, cultivate, and elevate. Join the excitement and fun for 8 amazing days at the Ghana Garden and Flower Show on the 22nd to 29th of September this year. The venue is the Ifwa Sutherland Children's Park from 9 a.m. to 9 p.m. each day. The theme is Greenovation. Green the nation, feed the nation, grow the nation. Come discover how to turn your garden into a green powerhouse that beautifies, feeds, and grows you and the nation. Come to the daily exhibitions, Green to Riches Youth Conference, masterclasses, Little Green Fingers, music night, drama night, kids playground, and many more exciting activities. Join the movement for a greener, cleaner, healthier, wealthier, and more beautiful Ghana. The Ghana Garden and Flower Show, an initiative of Stratcom Africa. Stratcom Africa, celebrating 30 years of pioneering, innovating, and impacting. Experience the Stratcom Africa difference. Now it's time for Lifestyle Daily. Of course, we are talking about raising awareness for sickle cell with this year's theme, Hope Through Progress.
Yes, and joining us for the conversation, we've got medical laboratory scientist and president of Sickle Cell Disease Support Group of Ghana, that's the SCDSG, in the person of Francois Agbokame. Did I get that right? Right. Okay. So Francois is Francis.
That's right.
Yeah, good. All right. And we've got Dinam Do Nuhoho. Did I get it right?
Yes.
Okay, she's a parent to a sickle cell disease person. And we've got Dr. Mrs. Avril say Akwade. Adakwe. Did I get that right now? Adakwe. Good. Great. She's a medical doctor. So today's conversation is quite very, very important. And as Diana did say, yes, we are raising awareness for sickle cell with this year's theme, Hope Through Progress. Yeah. I'll tell you what, because I have a lot of friends who are sickle cell, and you know, it's quite worrisome. And when they're in crisis and they keep on calling you and buzzing you and keep on calling you and buzzing you. Oh, can I please have something for my medications? Can I please this? Can I please that? And it's sometimes it's you, the person, it even takes a toll on you because you're like, how is it that this person keeps on hitting up that, yes, I need this, 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 I need this. Doc, I'll start with you. Okay. First of all, let's talk about sickle cell itself. What is it? How do we get it? How does somebody become sickle cell in the first place?
All right. So sickle cell disease is an inherited disorder of the red blood cell. So, you know, we have blood, we have cells within the blood. We have different kinds of cell. Okay. So we have the red blood cell. But the red blood cell has a protein on it called the hemoglobin. And this hemoglobin has chains in it. We have 4 types of chain. So basically, we have the alpha and beta. And with that, you have different types. I won't go into that. But sickle cell disease is when you have let's say, a production of abnormal beta chain within the hemoglobin. So the red blood cell is round. The number one is round, flexible. It goes through the blood vessels, the tiny ones as well. But with the sickled cell, red blood cell is sickle shaped, like the one that used to cut rice in the farm. So hence, if it's sickle shaped, it's rigid, like it doesn't have the flexibility to pass through the blood vessels and the microvessels. So then, like basically that's it. But the individual will get it from the parents.
Okay.
So they inherit one gene of the hemoglobin from the mother and the father. So if you have both parents with both having sickle cell disease, so let's say the mother is AS, it's a trait, and then the father is SS. You have one AS and the rest will be SSS. And genetics will not say, okay, since it's SS, I'm going to choose AS. No.
Okay.
It can be all SS or all AS. That's how you can get it.
Okay.
Yes, of course.
So it's just herited.
Yes, please, from both mom and dad, because you get one gene from mom, one gene from the dad.
So then this comes to the awareness of knowing your genotype.
Yes, please.
Is it?
Yes, please.
Oh, wow.
So I'm going back to the ASSS.
Okay.
Now, somebody is a sickle cell carrier when
Yes,
the
please.
person is AS.
Yes, please.
Okay, and then you have sickle cell when both SS.
Yes.
What does having a sickled cell mean for you as a person? Like what? I know that it's about oxygen or.
Yes, I'll go into that.
Okay, yeah, that's what I'm asking about now.
Okay, so with the sickle cell disease, as I said earlier, you have rigidity of the red blood cells passing through. So it's kind of occlude the smaller vessels and other blood vessels to various parts of the body. So it affects the whole body in the sense. So you have low amount of oxygen in various parts of the body. So you realize that, as you said, they're always calling for pain, pain, pain. And with the sickle cell disease, we have different types. And I mentioned that we have the beta cells being defected. So depending on the degree of the defect of the beta cell, then you have different types of the sickle cell disease. So the sickle cell anemia is under the sickle cell disease. Okay. You get it? Okay. So there are different types, but the commonest one is the sickle cell anemia.
Okay.
Because it makes up about almost 90%. But we have the hemoglobin SC. So it's also another type of sickle cell disease, also second commonest. We have the beta thalassemias and so many. But in that part of our world, it's more of the sickle cell anemia. Then you have the sickle cell trait. The person has a normal hemoglobin and the defect one, so you have the AS. But with the sickle cell anemia, they have SS. And then with the sickle cell hemoglobin the hemoglobin SC, do not have any normal hemoglobin. So we have one S and one C. It's due to a genetic mutation in the genes, yeah.
What are the symptoms? I mean, if somebody is a carrier of sickle cell, what are the symptoms? What are we supposed to see, or what would we see?
Okay, so sickle cell actually affects every part of the body because you have blood vessels everywhere. So their clinical features, they usually call the sickle cell crisis. So under it, we have the vaso-occlusive crisis. This one is because the blood vessel is blocked by the rigid cells. So you don't have oxygen, and the cells are deprived of oxygen, and then they cry out in terms of the patient having pain. So you realize they have the painful crisis. It's very sudden. It's sudden and very severe. It affects the bones. It affects the lung bones. You realize that they complain of joint pain, they complain of leg pain, they complain of headache. Then you realize that even in children, so from, let's say, 4 months, 6 months onwards, you realize that the parents will come to the hospital. My daughter's or my son's hand and feet are all swelling, and I touch, she's in pain, she shouts, she's crying. And they also have something called acute chest syndrome. It's life-threatening. It's whereby they come in with sudden cough and shortness of breath. They usually have fever. They have other respiratory symptoms. And usually they are prone to infection. Their spleen is also affected because the vessel that goes to the spleen is blocked. So you have a lot of blood accumulated in the spleen. Then you realize that the person just become anemic. And the spleen helps to filter the blood and also filter it from other microbes. So then they are subject to infection. They have a lot of infection going on. So already infection predisposed them to having the crisis, and then the spleen that helps them to fight the infection is also infected. So you realize that the complaint of abdominal pain is because the capsule around the spleen is enlarged, the liver too is enlarged, stretching the capsule, they are in pain. Also, it affects the eyes. They have sickle cell retinopathy. So you realize that they'll start having hemorrhage in the vitreous, like they have vision problem. You can even have a whole lot of, you can even get, let's say, vision impairment if they don't see the ophthalmologist. So they also have stroke. Like it blocks the blood vessels to the brain. They can get aneurysm. It's also a complication of it. They get leg ulcers. They get priapism. So if the priapism is not resolved, they can get impotent, especially the boys. They get a whole lot of leg ulcers. They get stroke. They get cardiomegaly, heart problems. Like it affects everywhere.
And all of this that you described, children can
children to go through that, and adults.
So I feel like what you just described are for the people who have SS and then SC.
So the SC will have the milder form of it. And
mother?
Milder, like
milder.
the
Okay,
mild
right.
form, but the SS have the severest clinical presentation.
So if you are a carrier, if you're AS,
you don't show anything.
I heard that AS people, they don't even get malaria as often.
Yes, so about 1,000 years ago, according to research, they realized that the sickle cell traits actually protect against malaria. It's because of evolution. So all this, like the blood cells and everything, went through genetic mutation, and then we had all this, yes.
I don't even know what to say because people are going through so much. We have, Dinam, you have all the things that she's spoken about, you have sort of experienced that firsthand because you have a kid that has sickle cell. When did you first realize that there was something wrong somewhere?
When he was 4 months.
What was going on?
I realized he doesn't sleep well. He cries throughout the night. He's always warm, sometimes hotter than he should be. Then when he gets cold, he doesn't go early. Sometimes 2 to 3 weeks, the cold is still there. Sometimes he can cough like a month. Then I realized things are not normal. And we normally go to the hospital. But before marriage, I did the test, and I was given negative reports. So we went ahead with the marriage. And knowing I am negative, my mind wasn't there. I know it can't be sickle cell or something, so I was treating infection. My attention is towards infection. So all the time when I go to the hospital, then I was like, oh, it's like my son is having infection. Sometimes when we do the test, we realize that there is a trait of infection. So we are always treating that. And when he was around 9 months, I went again, and all the time his HB is lower than 9, sometimes 8, sometimes 7.5. And it was alarming. He's just a baby. Why should the HB
I'm sorry,
be
Doc,
that?
the HB is supposed to be...
So it depends on the individual. So you have a level for a child.
Yes.
So you have like 13, 14 upwards. So if it drops to like 8, then it's alarming. So that means there's something causing it.
Yeah.
But then they were like, oh, it's to go. Maybe I'm not eating well, I'm not feeding him well, you know. Then I was doing everything, but still. So when he was 9 months, I went back to the hospital. He was very weak. So we went back to the hospital, and I met a lab attendant. Then he was like, Auntie, you've been coming here all the time, doing tests, and let me do sickle cell for. And I was like, oh, okay, I'm negative, so I'm not sure it's that.
So when you say you are negative, what does that mean?
Meaning I'm sickle cell negative. I'm AA.
You want to come in?
That's my field.
Okay,
so,
no problem. Talk to us.
So I'll be speaking from
a lab tech.
Medical lab perspective, and then as a parent too.
Okay.
So I'll be combining both. But what she means is that there are 2 categories of testing for sickle cell.
Okay.
There is one for screening test, where you look at whether the hemoglobin S is there at all.
Yeah, exactly.
So we usually use these during mass screening and rapid, point of test screening. There are kits for it, and then there are some we use an HB electrophoresis machine for it. But then the screening ones, there are times when it comes to sickle cell disease, we always advise HB electrophoresis because it gives you a result that is reliable. On top of that, HPLC, it's able to outline all the various forms of hemoglobins Dr. Point on, the F, the C, the A, and all that for you, and then quantify it for you in various categories. Where one predominates beyond 50%, then you are shifting towards that genotype. Yes. So the screening test will not be able to do that. So there are instances where maybe pre-analytical, the true state of the person is misdiagnosed. So in her case, she's AS, but then she was told she's negative. There's an S, but she was told she doesn't have an S, so she's negative. So in an instance where you are positive, there is an S, then you have to go ahead and do HPLC to see which one you have, whether you are AC, AS, F dominance, D, and the rest. Yes. So when it comes to sickle cell, we always advise go with HB electrophoresis or HPLC before marriage, during counsel, to know your true state, so that you wouldn't find yourself in the situation, because it has a lot of burden psychologically, financially, and all that. And I know a lot of Ghanaians are facing this. Yes. So we use this opportunity to appeal and encourage everyone, know your true status. Do HB electrophoresis or HPLC and find your true status before you make any decision that might impose a burden on innocent child that will have to go through crisis here and there. So
please continue.
No, but before that, sorry, Francois, please reiterate on the tests again. Yes. You said it's HB what?
Electrophoresis.
HB forensis.
Electrophoresis,
yes. Okay, HB electrophoresis, and then the HPLC.
Yes.
Okay, so these are the two. Which one did you mention that it looks quite quick and people might just feel like...
Yes,
that's a screen test.
Yes, sickling test. We call it
test.
sickling test, yeah. That will give you whether you are positive or negative.
All right, so then that means... I'm quite confused because before marriage, you will be advised to do so. Yes. So you go to the hospital and then you go like, okay, you want to do a sickle cell, test. You get it. So what will come will definitely bring in your blood group and your genotype and everything. Okay, you are AA, or you are B+, you are this, you are that. Those things. So is that what you're calling a screen test?
No. So that should be the HB electrophoresis or the HPLC.
Okay. So what results do you get with the screen test?
So the
positive or negative?
Positive or negative.
Oh, okay.
So it's actually looking for the S hemoglobin.
Okay.
Whether there's an S there at all.
Okay.
If it says positive, then you don't end there. You are required to continue with HPLC to know the true state.
Okay.
Which of the hemoglobin combination you have.
Okay.
So it's important that you don't rely on it end at, even if it is AA, I would say even if it is negative, means you don't have an S there.
Okay.
Then I still advise that you go ahead and repeat with HPLC before you proceed with your marriage.
Okay.
That is because with the experiences and then research so far has unveiled that a lot of us colleagues find themselves in this situation as a result of these. Either they don't understand when the lab man is explaining, they are just in hurry, and then off, I'm negative, and then let's go ahead with the marriage. So at times we are quick to blame the lab. Imagine there was a lab scientist who requested that, no, let me do HB electrophoresis for you.
That's what happened with you.
Yes.
That is after the birth.
After the initial SS negative that she had, and the child still was falling.
So yours was AA negative.
So the screening
No,
test,
they
didn't
just
tell you
told
whether-
her
Whether it was
negative.
positive or negative.
So she
Yes.
felt, oh, she's safe.
She's safe.
I don't have an
Yeah.
S.
So they didn't even tell you whether you were AA or not.
Exactly.
Exactly. Just
Until
said
she goes ahead
I
and
had
do
to
the
do
HPLC or the.
No, but I think that then we should still hold some of you accountable. Because
so-
it's not everybody that understands what you are telling us right now. If I come to you and I say I'm coming to do tests, and then you say, oh, I'm negative, and I say hallelujah, and I go and marry, I feel like it's still up to you to further explain that, you know what, it doesn't end here. The negative, we are still not too sure, so please go ahead and do this. Is that what happened with you?
Yeah.
They asked you to
No,
go
they
ahead?
didn't ask me to.
See what I'm saying?
So
I was just giving a test.
See what I'm saying?
let me come in there. Let me come in there.
Defend your people.
So the no marriage counselor will request a screening test for
Yeah.
a premarital screening test to be positive or negative, just Sickling test. They will have to request HB electrophoresis or HPLC. So I can say that most of it has to do with marriage counselors or those who request.
Okay.
And then there are categories of lab requests that comes depending on why you are doing the test. Some will warrant HPLC and AB electrophoresis. Some will say, oh, just come and do a screening test. So in her case, I believe it's supposed to be electrophoresis or HPLC because this is a case for marriage.
Yeah.
Yeah.
And we always do well. We don't just release report. We always do well to explain.
I mean, we
Yes,
just wanted
please.
to get that one out of the way.
Okay.
Yes.
Okay, so now you've met a lab tech who
Yeah.
expressed interest in testing for
Further,
sickle. So
yes.
yes, and then what happened?
So when I was asked by a doctor to do sickling for him, and when I went through the test, it is a positive. So I was like, okay, positive. I know AS is also positive. So maybe that is the positive
that you're talking about.
that he had. So the guy was like, oh, let me do, there is a further testing
Right.
that he can do to check and see if there is any abnormalities. And I was like, oh, okay. Then I paid for it, but I took the first one for treatment because he wasn't feeling well. And I was so, in fact, he was so tired, weak, and crying all the time. So I was like, so I'll come back for the other test. So let's go and commence treatment. So when I went, I met the doctor. I was like, okay, so now let's do some basic things before, as we await there.
Okay.
So I think 2 days later, after 24 hours, I came back for the other test, and I had a shock of my life. He has SS, and that explained everything he was going through. And at that time, sometimes I realized his wrist is swollen, the ankle, sometimes the knee, sometimes the here. Then I was like, what may happening to him? So I thought maybe we are not handling him well.
Right.
Yes. He was always in pain. He doesn't eat well, always vomiting everything he eats. And it was a whole lot. It wasn't a nice experience at all.
How old is he now?
He's now 7, going to 8.
And
Maybe.
can you, I want to say, can you quantify the amount of money you spent on treatment? In just 7
In
years?
just 7 years.
That's a lot.
No, I'm asking because I think sometimes when we have such conversations, it seems very abstract to people. Because, again, the way you've explained it, you understand the medical terms. The people watching me, we are just trying to hold on to the conversation and try to understand what's going on. But then when people like you come on board and then you share your stories and you are quite specific about the things that you are going through, it makes much more sense to people, because we say it every year. We talk about sickle cell every year, and still people go ahead and marry and say, you know what, love conquers all. Yeah, what God cannot do does not exist. But it's real life. It's real life. This is a child we are talking about, just 7 years, and at 4 months, he has visited the hospital so many times. That's why I'm asking.
4 to 9 months. Visit the hospital like about 15 or 20 times.
I met him, right?
Yes.
Yes, you met him.
It's just too much for a baby. Just 4 months, and you visited the I honestly want us to be very, very raw. Let's be raw. Let's explain to people how deep this is. Because we are not talking, it's not something that strikes when you are grown, that we can say, okay, you can sort of handle yourself. 4 months, 7 years, and the person is, this is a child, for crying out loud. So, yes,
I
you
would
want
like to add a bit
talk to
to
me.
your question of financial burden.
Right.
Because the sickle cell disease support group is, comprises of patients, caregivers, and their relatives. And we get first-hand experience from how they go about their day-to-day life as far as sickle cell disease is concerned. It's quite burdensome. It can be quite arduous. Currently, to commence treatment, you need at least 4 laboratory tests to commence treatment, in addition to all the prerequisites that Dr. mentioned. At least you need a full count, you need a BU creatinine to check your liver and your kidneys, GCPD, and at least.
Can you give a range of how much these cost,
so
depending on the hospital?
It depends on the hospital, but you can spend a lot, like more than maybe 400, 500 cedis.
Per test?
No per test, maybe if you sum everything.
Just this 4.
I think the time I did for him, it was around 600.
600 years.
Imagine that time.
Maybe medication.
Yes.
Is the medication free?
It's hydroxyurea is now on NHS. And thanks to the government for that, and we really appreciate that. It has gone further to reduce the burden on
Come back to that.
yes. But then there is still a long way to go. Yes. And then the labs, before you go for your next appointment, 2 months' time, 3 months' time, you need to repeat at least full count.
Full count.
And then every year you need to do TCD scan, transcranial Doppler scan,
For children.
to determine
Every year.
yes, to determine whether you have a prospect of developing a stroke
or not.
Because that is
Yes, the risks of, as I said earlier.
I was
So sorry.
I was shocked. Children
And then you have to
suffering from
visit
sickle
the
cell disease.
the ophthalmologist
Yeah.
too. That's a different cost.
Yeah.
So sickle cell disease is one condition that is, if you are not at the right place, that has the right information at the right time, is more or less, excuse my word, a death sentence.
Yeah.
And in sub-Saharan
serious
Africa,
one.
the situation is dire.
It's bad.
Yes, because 2% of our population.
The newborns are actually
Newborns.
diagnosed. So that you have 15,000 newborns
Really?
being diagnosed every year.
Every year.
So you can
listen,
imagine
15,000.
15,000. Then 25% have the sickle cell traits. So if they are marrying each other, they need to triple. Yeah.
So the financial burden is huge.
Yeah, exactly.
And there is a lot the government can do. And we can only do a lot.
By
And at times our lot is little.
Yeah.
Yes.
Yeah.
So the burden is huge.
With that being said, Francois, now let's get into the support group. What does your support group stand for, and how best can we, help to, get the awareness done? Of course, you're here, and most definitely that's why you're on MX24. But talk to us about the Sickle Cell Disease Support Group of Ghana. What do you stand for?
I will start with a bit of a story.
Okay.
Just last month alone, we were able to refer at least 7 individuals to commence treatment. Individuals who never had idea they had sickle cell disease, but have been battling with crisis here and there. Either they are rushed from school, secondary school, or home to the emergency, and then they get pain treatment, and then after that they are released home, only to return back on another episode. That's the unfortunate situation. And the more you are subjecting yourself to this pain episode and the treatment that comes with it, the higher the risk on your organs. So it is very important that early screening is initiated. Once you realize the patient has the condition, the patient is placed on the approved, well-standard treatment that is available to us all here in Ghana. So we come in, we have launched a program called Outlook, where we look out for those who know or doesn't know, but when you know, don't even know where to go, how to go about it. We look out for them, we serve as counseling, we direct them to the appropriate treatment facility, Kolebu, Ridge, and other teaching hospitals to commence treatment as soon as possible. So just last month, between 7 and 8 were successfully placed on treatment, and they have commenced. Some have commenced, but then they don't really understand the condition and thought after 1 month treatment, I'm cured. Some even say when they are on the penicillin prophylaxis, it changed the genotype that doctor described. I want to stress that sickle cell is a condition that you are born with and it stays with you.
So you're dying.
Yes.
That is the unfortunate situation. But now it is not as scary as it used to be by God's grace with the treatments in place, hydroxy and other treatments in place. I think Doc can touch more on that.
Okay, Doc, let's go.
So with the treatment, we have the pharmacological one and the non-pharmacological one. So with the non-pharmacological ones, patient education is important. You need to educate them on risk factors that worsens their crisis. So we have cold, infection, stress, extreme exercise, alcohol. And if it's a female, you should let them know that pregnancy itself can also worsen their crisis. So you tell them that they need dehydration. So they need to hydrate well, rest, avoid stressful situations, avoid extreme exercise. So if it's a male, you want to do weightlifting, please, you have to stop. You just do your mild to moderate exercise. You need to avoid having any form of infection. So you need to take your prophylaxis, as he said. You take care of yourself, eat well, balanced diet, make sure you are fine. You go to regular checkup. Know your body as well. So if you start seeing the signs and symptoms, realize that your eyes is more yellow than before, or your urine is more concentrated, like it's orange, even let's say brown, very deep brown, it's almost red-like.
Coca-Cola.
Yes, you just have to go straight to the hospital. If you realize you can't breathe well or you're coughing with fever or not, just go to the hospital, get yourself checked. And clinic is important. Enroll in the sickle cell clinic. You need to enroll. It's important because they'll teach you what to do. They'll give you folic acid. They'll put you on the treatment regimen. So also you need to stay warm. Cover yourself. Just because you have sex pack or anything, don't expose it. Just cover yourself. Make sure you are fine. With the pharmacological one, you have the folic acid. Depending on your HB, if you have your stable HB of 9 and you realize that it's maybe 7, the doctor, depending on the laboratory investigation and examination at that point, you either choose maybe blood transfusion or maybe some hematinics. Then we have the disease-modifying therapy, hydroxyurea. We know we have, we spoke about different types of HB, right? So you have the fetal hemoglobin that has high affinity to oxygen. So the hydroxyurea actually helps to increase the fetal hemoglobin. So in as much as your red blood cells is breaking as early as 10 to 20 days, it will help increase the chance of having more oxygen within the system to prevent vaso-occlusive crisis and prevent end organ damage. So there are other treatment plans. You have the stem cell implantation, that is from the bone marrow to help that. I think they do it at Ridge as well. Yes.
So because you mentioned women, I wanted to find out the way we have a lot of hormones playing in our bodies. When it comes to women and their crisis, would you say hormones also trigger certain things? And even being in your period, would that also trigger a crisis?
So being in your period, you're already stressed. You have cortisol level increasing because of other hormones. So that one is also a stress on the body. So such individual needs to rest, hydrate well, take pain meds. So you see the doctor. You don't just go to the pharmacy and get over-the-counter pain meds. No, because the pain is severe. So you need to see your health practitioner to help you grade the pain, because you have a pain ladder in the hospital. So you have 0 to 10. Some will tell you 10 on 10. They can't even bear the pain. So then the doctor will, okay, apart from maybe some para or NSAIDs or other things, I have to add an opioid to help manage the pain. And this opioid also have their side effects.
Yes, like addiction.
Addiction. So that's when we will tell her, it's like, we'll make sure you're not addicted to it.
Easy.
Yeah.
Is your kid on painkillers?
Then he was saying the normal painkiller.
No, so you have chemo for children, so ibuprofen.
Yes, ibuprofen and para.
And para.
Yes.
Was it a constant thing?
No.
No, it depends.
So I'm coming...
Unless he's in pain, and the pain is more than what para can do, then I replace his with.
So I'm coming from that point up to somebody who has reached, let's say, 27 years. It means that you've been taking medication consistently up to. So how does that affect your kidney?
So you know the kidney actually filters things out. So then it depends on the individual. So as I said, patient education is important. So if the individual goes to hospital often, the crisis would reduce. Okay. But if you have someone who doesn't know or doesn't have the money to go to the hospital or doesn't care, they realize that the person will be exposed to more crisis. And the more you're exposed to crisis, you're in pain. You take more drugs and to affect your kidney. So
I want to touch on that a bit. The risk you face on medication compared to not on the medication at all. The former, no, is it the risk the risk you face, or the risk at hand when you are not on medication?
It's more.
It's serious.
It's serious, yeah.
Compared to when you are on
Medication, yes.
So every time you go for a revisit, you have to do a full blood count at least.
Yeah.
That is meant to monitor effect on your system, how well you are responding, whether there is a need for any adjustment. So the laboratory diagnosis aspect of it is very, 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 very important.
And then your kidney test as well, to see what is happening.
Yeah, so yearly you are required to do that.
Kidney injuries as well.
So whenever you do a full blood count, can it automatically also detect, for instance, for what she went through? Maybe, yes, she was told, oh, she's positive or she's not negative or something of that sort. Then she maybe, as an adult, something happens and she goes and she does a full blood count. Could it be detected that, hey, I mean, you're a carrier? Could that be detected, or it has to be specifically on the HLPC that you spoke about?
Yes.
Oh, okay. Yes. All right. Okay.
I want us to come back to some of the challenges. Apart from financial challenges, what are some of the challenges you've had to face taking care of a child who has sickle cell?
Yeah, sometimes you don't have time for yourself. You become very clingy. You don't want anyone to take them. They want to follow you everywhere you go. So I remember sometimes I have to place him in a curtain closer to where I'm the bathhouse to be looking at him before I bath. Yes. So sometimes I'm a teacher. You can imagine. You can't send
if you're an entrepreneur, if you're doing your own business, you're a teacher.
Yes. So sometimes you can't send your child to school. He's small. He's sick. You don't even know what is wrong with him. He's weak. He can't eat. You can't leave him with anyone. Who will have time to take care of him? So I have to send him to school, leave him with a kindergarten teacher. Then I have to be going up and down, checking on him, teaching. So it affects your daily life.
This is hard.
And at that time too, I wasn't aware of any management, like the treatments, anything. He was only taking folic acid, and I was advised to add penicillin V to it to reduce the infection. And that is what I was doing then, and maybe checking on his diet. The ones I would give him to give him more blood, the HB to go high, not to reduce, because anytime the HB reduces, I'm in trouble. Within the 7 years of his life, he has received infusion twice, blood twice. Twice. So you can imagine what. And when I went for further studies, I have to be running up and down. I couldn't take him there because
You're
going
so
with
strong.
him, yes, I have to
Because
move on.
that's so important, and
Yes.
I'm really happy that you said that you didn't let that stifle you, put you in a box and make you sit at one place and say, you know, I'm taking care of this person and that's just it. I'm glad that you still found time and you still.
It's not easy.
What is your headspace like? Your mental health? No, honestly, it's because
We'll have
what's
to
your
tap
mental?
into that.
Yeah,
Because
what's your mental health?
Yes,
like?
from the beginning it was very small because it got to a point I couldn't sleep. I'm always awake, like 2 days straight. You won't be able to have any sleep at all. You're always checking on him, checking his temperature. They say don't bath him with cold water. So I have to do a towel, how do you call it?
Tepid sponge.
Yes.
Responding.
Always doing it slowly to reduce it. So don't just reduce it at once. And all those, it was draining me. I became very slim. In fact, I was looking like someone who is Who is malnourished?
And I want to add to that currently in Ghana, the treatment centers are very, very, very limited. That's one huge challenge sickle cell patients are facing. Some have to travel all the way from Nkoko, Swedru, Dowenya, Fienya to reach to access treatment center. That is the issue. Some have to come from all the way close to Kumasi. So geographical location is an issue, and that is further imposing financial burden because by the time they get home, transport and labs and other things alone. So at times patients lapse treatment for over a year and only come back to the emergency ward. So we are using this opportunity to appeal to the government we know the Agenda 111 is almost ready for us. There are a lot of upcoming clinic, hospitals and children hospital, district municipals, just like diabetic treatment center or high blood pressure treatment center established at all these centers. We think sickle cell disease should be given much attention. There should be a sickle cell disease clinic in every municipal and district hospital. That is what we are advocating for.
And that will save a lot of life and stress and mental.
Mental stress.
Yes, exactly.
I would like for our producers to bring back the chart again, because I think that's the awareness just springs from that. Exactly. Good. So now on the screens, please put it on the screens for us so that Francois can take us through this again. Okay. So Francois, what I want to ask is, if you go and do the test and the test results comes as AA, would you have the test result telling you that there's something like AA positive or AA negative? Is that what happens, or is just AA straight?
So this is looking for whether there is an S there at all.
Okay.
The defective mutation that results in the S, whether it's there at all, because that is what we don't want.
Okay.
And at the end of the day, there wasn't any S at all.
Okay.
So you can see
if you go
100%
for a test and it comes in and it's AA.
Yes. Okay.
You know
Green
you're
light.
okay.
Yeah, green light.
Okay. All right.
And then when you come to the AS,
That's the carrier.
they can marry because there is no way two S can combine to give you
SS.
a condition.
Okay.
Because S is just one.
Okay.
When you pick one from here and pick one from here, the worst case scenario will be AS,
Okay.
a carrier.
Okay.
And that would be just even 1 out of 4.
Exactly.
Exactly.
Yes.
Exactly.
All
The
right.
mass is good.
So that's 25%.
Oh, no, please. I did science.
Yeah, I get it.
Yeah. Talk to me nice. Thank you.
So then we have the AA and then the SS.
Yes. So that's one they can marry.
They
to.
can also marry.
Don't worry.
AS ni AS. No.
They be
Not recommended.
So, this means that when Kofi and Amma decide to copulate today and bring forth a child,
the probability.
the probability, that very pregnancy that the test they did and say I'm pregnant, there is a 25% chance that that baby coming out will be SS. Will carry S from daddy and carry another S from
mommy.
And
So
become
that's
an
100%.
SS,
Yes.
where we bring forth an innocent child that will be subject to all this harsh weather.
All this, I'm not seeing C in there.
Yes,
Where does the
there
C
are
come
C.
in?
When you go on, you can see.
Oh, okay.
You
All
can
right.
see C. In fact, you can
So you
see
have
C.
SC, you have AC.
AC,
So
yes.
depending on.
Yes. Yes.
And the C2, when you see it, you should be...
Yes.
If you already is, but not as much as the SS.
So the last one, you can see 0%. That means.
Not at
Let
all.
me use to if you move time.
No.
And then I want to touch a bit on the 25% chance. People want to bank on that and do lottery with that,
No, but
and it doesn't work.
How can you do
Genetics.
lottery with somebody's
Yes.
life?
so that's
No,
They
but
try.
that's the thing. So
I-
because you still have the
After
chance
the
of
chance
getting
of
AA,
AA.
you can get a child with AA, you can get a child with AS, and then you can get a child with SS.
SS.
But the SS is 1 out of 4.
Okay.
yes, but genetics will just play you.
Exactly.
Genetics will
Because
play
I
you
know couples who have gone 4, 5,
with SS.
and then they've eventually given up, and the marriage is broken apart.
Exactly.
Would you advise that someone goes in for a test and it's AA, he comes in AA, would you advise for them to go for another test?
Of course,
Just to be sure.
you are always at the
Just to be
liberty
sure.
to change
Okay. I have a question.
Okay.
When the child is being formed in the womb,
Right.
can we test?
Yes, we can.
At what point? Like how many months?
Okay, so around 15 weeks of pregnancy, there's something called amniocentesis, whereby they take a fine needle, pass it through the mommy's stomach to the where the baby is, take a fluid around. So the fluid has the cells of the baby, and they test it.
Okay.
Yes, at that time the baby is formed, so it is.
I was going to say, by that time it's 5 months. 5 months there.
So
You
that
just
one-
have to set your mind and prepare yourself that you are coming to take care of.
Or if you're not pregnant and you still decide, if you are AS, and you still decide, you have something called pre-implantation genetic diagnosis. So it's a laboratory test with IVF, that's in vitro fertilization.
Okay.
So they'll take egg from mommy, sperm from daddy, they'll mix it up and test. If it is
Then we
AA or AS, fine, we push it back into mommy's womb. If it's SS, we discard it. But you know, you have moral things attached to that, and also
financially.
ethics and finances. Exactly.
So that is why we are here today, and we thank you for giving us the opportunity. If you have the chance to make a choice now, why will you put that aside?
Yes.
Why don't you take the counsel we are giving now? Get tested, know your true status, and then make informed decision than going ahead anyway, praying to God, going for all nights, all the time, that the God can, miracles can happen. And I must say, it's unfortunate. A lot of children, especially in outer skirts of Accra, families go through a lot of persecutions.
Yes.
And they think it's a case.
Yes, curse
But
and
it's
all
not a
that.
case.
Yeah. But Francois, quickly with the group, are you in touch with government? Have you made arrangements towards it in terms of having a discourse, meeting
question.
with those who are in charge to see how best we can also get more? Because you just mentioned that it's limited. I mean, the centers are limited and all that. Have you guys thought about it? Are you in touch with them?
Yes. So I think last June was an international sickle cell day.
Yeah.
So we did a lot of activities. We collaborate with other NGOs in sickle cell.
Okay.
With International Sickle Cell Center, they did a marvelous job on that day. They launched and they threw a lot of awareness. We partnered with them, and there was a blood donation exercise as well. There were panel discussion. WHO, Ghana government, and all were part of the discussion. So every now and then we use this avenue to get in touch with the government, and we released there was a press release from the Sickle Cell Disease Support Group touching on these specific needs that we get, because more or less we are the direct voice for the patients, and therefore you can't make a decision for a person who is not feeling well without that person involving. You can't make a decision without their presence or without involving them, and therefore we reiterated in that statement that there is a need to bring us to the table, and then we present the patient perspective, the gaps in it that need to be closed, especially this. And at times, hydroxyurea is not available for over 3 months, although it's on NHS. So they have to, out of pocket, purchase it. One goes as high as 10 cedis, 5 cedis, 7 cedis.
Per tablet?
Per tablet.
Yes,
and the
per
person has to be on it daily. Daily. So if BP medication are as low as HIV medication are that low, why can't I just walk into a district or municipal hospital and get hydroxy on NHS? Just like HIV. Why should sickle cell treatment be restricted to teaching hospital, regional hospitals? Because it is one of the conditions that is rampant, and our future, the generation of Ghana relies on it. And I want to chip this in. Sickle cell patients are very brilliant, whether you like it or not. They are brilliant. Why are we going to just allow this generation perish? I think we can do more. I appreciate the government, but I think we can do more. So there was a press release. We will be releasing another one soon, and thankfully we are glad we will channel through you as well, calling for these specific needs that patient faces. So we use this platform to call the government in, draw their attention that there is a need for a dialogue around the table, involve those who are concerned to address their question, because without them, you are not addressing anything.
Okay. All right. Someone was asking that sometimes you go in for a test and you're advised not to have children more than 2, 3, or is it all because of the whole genotype thing, or what
The
is
statistics we just saw.
this one?
I think
Well, also with
it depends,
childbirth, it depends on the individual, because the woman is the carrier of the baby. So maybe there are other condition or medical illnesses apart from the sickle cell. So depending on what we see, that's when we'll advise you. So not necessarily because of that, but it's individual specific as well. Yeah.
So if a woman has been able to carry a child, and so for someone who has sickle cell, if she's carrying a child, it means she's going to be constantly under the microscope.
Yes,
anything
we watch.
can
We follow
trigger.
up. We follow up a lot.
Okay.
We make sure that we book care more than the usual antenatal care visits. So she, instead of maybe if somebody's coming like 5 or 6 or 8, she will come more than that, because we want to follow up. We want to check on the HB. We want to check whether she has infection. Is the baby okay? Is she fine? Like, we want to make sure that she's fine.
So it means that she probably wouldn't be encouraged to give birth natural, quote, natural
some
way.
are able to, but some too we advise that we do a CS for you, depending on the individual preferences as well. Because some will say, I don't want a CS, I want to push. You can't do anything
I'm
about
thinking
it.
about the whole stress that we kept talking about. That stress is a factor.
Yeah, exactly.
So, and I've not given birth before, but from videos, there's clearly a lot of stress. I mean, the way you are stopping me right there, there's clearly a lot of stress. I'm just thinking about someone who, giving birth, going through all of that. Won't that eventually affect?
Yes,
Yeah.
so some of them don't even know they have it. And some of them too, at ANC, we do the test and everything. We tell them, but they still tell you that I want to push. They don't have the money for the CS.
Okay.
So it's also a factor.
Yeah. There's so many factors getting in.
Exactly.
All right, Doc, where can we find you? Which hospital are you with? Where can we, if we want to consult with you, how can we go about it?
Oh, I'm currently on leave, so.
There we go.
but you can always find it through us.
Yes. Okay.
Okay, no problem. So then let's bring the question to you, please. Where can we find you?
Yeah, so you can always visit www.scdsg.org, and then we are our contacts. I think is 0249838633, and I think one of the benefits you have as someone who is planning to get married, someone who is a caregiver, and someone who has a condition is that there are periodic workshops that we organize from the IVF treatments. If you have a partner who is SS, but you still are locked in, you don't want to split, and you have the cash, you want to go about it.
Very important.
How expensive is
Add
that?
it, because the people they think that they think that it is an
Very. You see the way I
alternative.
cross my legs.
Very expensive.
Very expensive.
Because the IVF alone is expensive, and you're also going to do the pre-implantation genetic
That's
diagnosis.
exactly she said.
It's another.
Yes. So we give you all the nitty-gritty around that, and then how you take care of yourself and your ward on day-to-day basis. If you have a question that might need booking appointment with doc, when you are part of the SCDSG, you can get these important life-saving answers to, your day-to-day issues. So being part of the association has a lot of benefits.
Yeah, it's true.
Because they bring both a lot of doctors.
You can testify.
Yeah, I can testify.
And after she's been on treatment, I think she can smile compared to before.
Before, yes.
She's smiling. And
I
how are you?
She's glowing.
Can you imagine? So there are a lot of people who want to be in a situation. So we call you, reach to us. You can go to any of the Kolebu
Previous units.
Yes, Ridge or finance. What's 37 finance, and then we can direct you. If you know anyone who you think or suspect, you can advise the person to reach us, because we have this counseling section, and you feel belong. There is a sense of community, and you share from parents who have been with it, had the experience.
So you feel like It's not
You are
the end
not
of the world.
alone.
It's
You are not alone.
You are not alone.
Yes.
Actually, that was the ISCC's slogan for the
You are not
June
alone.
program. You are not alone.
Oh, they love
Okay,
Liverpool.
Even
I
that-
think our time is fast spent.
Okay.
Okay, you're saying something?
Oh yes, like before, our HB were very down, but when we started treatment, now I can proudly say I will not be anywhere and they will call me and say my son has fainted because of
See?
because of HB. Now his HB is always around 11.7.
Can you imagine?
So yeah, exactly.
Last we went, it was 12.
Oh, nice.
Yes.
Okay, but again, our time is fast spent. I
Yeah.
just want you to leave us with a message. Tell us one thing you wish people would understand better about what it's like to raise a child with sickle cell.
Yeah.
That's our last thing, and then
Yeah.
we wrap up.
Raising a child with sickle cell is not easy, but it can be easy when you have a community like the
SG.
Yes, like a community like this, you have they have a heart of good. Actually, they taught us a lot of things, and it makes our work easier. You understand your child better and how to handle the situation anytime they are in pain. Yeah. It's not a death sentence.
So
It's not.
We'll be coming to your
It's
lab
not.
very
It's
soon.
not a
Yeah.
death sentence. Yes.
We'll be
Thank
coming
you,
to your
thank
lab.
you so much.
Thank you.
This has been quite educative and
Exactly.
So much.
insightful.
Enlightened.
So, Francois Agbokame, Dinam Do Nuhoho, and Dr. Mrs. Avril say,
Adakwe.
thank you. Okay, so that wraps up Lifestyle Daily. Thank you so much for sticking and staying. After this, we have the plug.